There was an interesting note earlier today. I want to get your take on this, saying that essentially doing anything on drug prices can be very difficult. Tom Price, the nominee for HHS secretary, would not go for government regulation of pricing. And also Republican Congress won't approve that either. What's your take on whether or not this could actually mechanically happen?
I think it's mechanically very difficult for the government to control prices, especially this particular group of government folks who are very market-oriented. There are some ways they can incentivize the market to move a little bit faster in terms of developing new drugs and competition, but I'd say direct negotiation is not likely to happen. And but we know that drug prices have been and continue to be a very strong rhetorical talk point for politicians, and also really a pain point for a lot of people in America. So at a minimum, the rhetoric is bound to continue. Whether or not anything actually happens is sort of another story.
So are you basically acknowledging that it's very difficult to be an investor in this? I mean, you can say that, yeah, it's probably not going to happen, but you get a tweet, you get a comment, and bam, those gains are gone.
Yeah, well, you know, it's never not been difficult to be an investor, but yeah, it is something we deal with. You know, you have to put that into your valuation model. If Trump comes out with another tweet, you know, is it more attractive, down 3%, 10%? So it really, we deal with this. We've always dealt with regulatory issues. This is just the latest of many, and of course, who's going to run the FDA. Who's going to run CMS? Well, we think we know. Who's going to run HHS? Those are all issues that are up in the air. So I think at least at the moment, healthcare, unlike a lot of the rest of the market, is kind of in a holding pattern.
Les, I'm curious to hear your thoughts on this idea that, you know, Trump, during the course of the campaign, did express some support for the idea that Medicare should negotiate drug prices. Now, of course, in that note we saw from FBR today saying Trump likes to negotiate everything. He's never going to turn down the opportunity to potentially negotiate. Maybe that won't happen. Traditionally, it's thought that this would never get through a Republican Congress. But if the president-elect adopts this position, do you think Republicans could change their thoughts on that?
Sure, but that's really, I'd say from what we know right now, it's a little bit out there. Most Republicans have said they don't want to. I think actually there are a lot of Democrats who say they don't want to as well. Mechanically, to start negotiating directly now would be an amazingly large challenge. And they're actually going to scrap, if the Republicans repeal Obamacare, which they say they want to. There are some pilot programs in Medicare Part B that are going to go away, where some of these value-based issues were being brought up. So on the one hand, doing one thing, on the other, they're doing something else. So I guess we're just sort of in a wait and see until the staff is announced, and then we hear what they actually intend to do.
The drug companies liked Obamacare generally, didn't they, Les?
I'd say almost all of healthcare liked Obamacare. Right. The idea being more people insured.
Are they going to like it if it's repealed?
I think they're going to. Well, I think it depends on what comes afterwards.
Well, that's my point.
I mean, I'd say repealed and not replaced, I think, is actually most risky for the hospital sector.
Right.
But and certainly the insurance companies have lost a lot of money on the exchanges. So it sort of depends on what comes next. And unfortunately, even the people who claim to have crystal balls haven't said what's actually going to happen in the next couple of months.
I don't think anybody really knows.